Hi, Tim Russell here for Inovera Bioscience and Forvia Vitamins. Today I'd like to talk about 5 things that you might want to keep in mind when you're looking at medical news. There are lots of studies in the news these days about this or that drug, treatment, or disease, and often the write-up will describe a recently published medical study. But what should you be looking for to see what the study results might mean for you? Well, real quickly, are the people in the study like me? What is the study design? How big is the study? How big is the reported effect of the treatment? Does this report call the results significant? And I've got a sneaky one for the end. So are the people in the study like me? Take a look and see, was the study done in the U.S.? Because if it was done in another location, another country, the genetic makeup of the folks may be different from the U.S. population. How about the age and the sex, the severity of the disease level, the treatment history? In other words, are these folks taking similar drugs to what you may have been exposed to? Now, what was the study design? The gold standard in studies is a double-blind, prospective trial. What that means is that double-blind, neither the people participating in the study or the observers measuring the results know which patient is assigned to either the treatment or the placebo or sham treatment. With neither one knowing, that supposedly eliminates all bias. Sometimes that can get complicated if the type of study means that the results will be very obvious to the participants. Think of a sunblock trial where the sunblock works, but the placebo people all get sunburned. It would be pretty quick and obvious to figure out who's in which group. How big is the study and how big is the reported effect of the treatment? Well, bigger means more reliable, whether it's the number of people in the study or the size of the effect. You want to be sure that the size of the effect really makes a practical difference. And the size of the study is a little bit of a two-edged sword. If it's very large, it can pick up small differences between treatments, but they may not have much practical meaning. A 1 or 2% difference probably would be hard to notice. So does the report call the results significant? Sometimes in press write-ups they skip that, but it's always included in the published scientific study. And it's a statistical term, and it basically means that it would unlikely that the results would be by chance, usually 1 chance in 20 or 5% or less. As an example of how that works, if you had a coin, flipped it 10 times and came up with 6 heads, 4 tails, you could see that could happen very naturally. But if you flipped it 50 or 100 or 200 times and still had a 60-40 split between heads and tails, you'd start to think there was something very off about that coin. And finally, I promised a sneaky 5th item. Sometimes the publications show a graph of the results. That's always nice because you get a good visual, but be careful that the axis starts at 0 and not someplace in between. A lot of times in news reports, to save a little bit of ink and especially space, they truncate or shrink the scale and perhaps start at 40%, ranging up to 80%. And what that does is give you a false impression of the size of the difference between the 2 lines or bars on the chart. So, hope that helps. That's all from here today. Thanks very much for listening. Bye now.